Have you ever experienced pain that seemed out of proportion to an injury, lasting much longer than expected and accompanied by swelling, changes in skin color, or temperature fluctuations? If so, you might be dealing with a rare but serious condition called complex regional pain syndrome, or CRPS. This chronic pain condition can be incredibly challenging to live with, but understanding its symptoms, diagnosis, and treatment options can help those affected find relief and improve their quality of life. In today's video, we'll explore everything you need to know about CRPS, from what causes it to how it's diagnosed and what treatment options are available. Whether you're experiencing symptoms yourself, know someone who is, or are simply curious about this condition, stick around as we'll break it all down in an easy to understand way. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Complex regional pain syndrome is a chronic pain disorder that usually affects one limb, such as an arm or a leg, typically following an injury, surgery, or even something as minor as a sprain or fracture. However, the pain experienced with CRPS is much more intense and long-lasting than what would normally be expected from an initial injury. This happens due to a malfunction in the nervous system, leading to an exaggerated pain response. CRPS is divided into two main types. Type 1, also known as reflex sympathetic dystrophy or RSD, occurs without direct nerve damage. It's the more common form and typically develops after an injury, like a fracture or soft tissue trauma, but with no obvious nerve injury. Type 2, previously called causalgia, is less common and occurs when there is a clear evidence of nerve damage. Despite these differences, both types share similar symptoms and can lead to significant disability if not managed properly. The exact cause of CRPS isn't fully understood, but researchers believe it involves a combination of abnormal inflammation, dysfunction in the nervous system, and changes in how the brain processes pain. When the body experiences an injury, the nervous system sends pain signals to the brain as a protective mechanism. However, in CRPS, these signals become amplified, leading to severe pain even after injury has healed. Additionally, the immune system plays a role by triggering excessive inflammation, further contributing to pain and swelling. It's as if the body's alarm system gets stuck in the on position, making even the slightest touch or movement excruciating. So what does CRPS feel like? The hallmark symptom is severe burning pain that is out of proportion to the original injury. This pain is often persistent and can spread beyond the initial site. Many people with CRPS also experience change in skin temperature, with the affected limb sometimes feeling much hotter or colder than the rest of the body. Skin color changes are another common symptom, ranging from red to pink to purple or bluish hues. These fluctuations often occur due to abnormal blood flow regulation in the affected area. Swelling is another major feature, sometimes making the limb appear puffy or swollen for extended periods. In some cases, the skin may become shiny or overly sensitive to touch. Even light contact, like clothing brushing against the skin, can cause extreme discomfort, a phenomenon known as allodynia. Muscle weakness, stiffness, and reduced mobility can develop over time, making it difficult to use the affected limb. In more advanced cases, CRPS can lead to muscle atrophy, nail and hair growth changes, and joint contractures, where the limb becomes permanently stiff and difficult to move. Because there is no single test for CRPS, diagnosing it can be challenging. Doctors rely on a combination of clinical symptoms, medical history, and physical examination findings. One of the key diagnostic tools is the Budapest criteria, which outlines specific symptoms and signs that must be present to confirm CRPS. These include ongoing pain disproportionate to the initial injury, sensory abnormalities like hypersensitivity to touch, temperature changes, swelling, or movement difficulties. In some cases, imaging tests like MRI or bone scans may be used to rule out other conditions and check for characteristic changes in bone density that sometimes occur with CRPS. While nerve conduction studies and electromyography are not typically used to diagnose CRPS directly, they may help identify nerve damage in cases where type 2 CRPS is suspected. Because early diagnosis is crucial for better outcomes, anyone experiencing persistent and unexplained pain after an injury should seek medical attention as soon as possible. Now, let's talk about treatment. Managing CRPS requires a multidisciplinary approach, often involving pain specialists, physical therapists, and mental health professionals. The goal is to reduce pain, improve function, and prevent long-term complications. One of the first-line treatments is physical therapy, which plays a crucial role in keeping the affected limb mobile and preventing stiffness. Gentle stretching and gradual movement exercises help retrain the nervous system and reduce pain sensitivity. Desensitization techniques, where the affected area is gradually exposed to different textures and sensations, can also help reduce hypersensitivity. Medications are often used to help control pain and inflammation. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, may be used for mild cases, but more severe pain often requires medications that target nerve pain, such as gabapentin or pregabalin. Low-dose tricyclic antidepressants like amitriptyline can also help by altering the way the nervous system processes pain signals. In some cases, corticosteroids may be prescribed to reduce inflammation in the early stages of CRPS. For those with severe pain that doesn't respond to standard treatments, nerve blocks may provide temporary relief. These involve injecting anesthetics near the affected nerves to block pain signals. More advanced treatments include spinal cord stimulation, where small electrical impulses are delivered to the spinal cord to interrupt pain pathways, or sympathetic nerve blocks to calm overactive nerve responses. Mirror therapy, a technique that uses a mirror to create the illusion of a normal movement in the affected limb, has also been found to help some patients rewire their brain's pain perception. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, in addition to medical treatments, psychological support is an important part of CRPS management. Chronic pain can take a toll on mental health, leading to anxiety and depression. Cognitive behavioral therapy, or CBT, and other pain coping strategies can help individuals manage stress and break the cycle of pain amplification. Support groups and counseling can provide emotional support for those living with CRPS. Lifestyle modifications can make a difference as well. Managing stress through relaxation techniques like meditation, breathing exercises, or yoga can help reduce pain sensitivity. A balanced diet rich in anti-inflammatory foods may support overall health, and maintaining a regular sleep schedule is crucial for pain management and recovery. Since CRPS can make everyday activities challenging, working with an occupational therapist can help patients adapt their daily routines and find ways to perform tasks with less strain. To recap, complex regional pain syndrome is a chronic pain condition that often develops after an injury, causing persistent severe pain, swelling, and changes in skin temperature and color. It occurs due to an overactive nervous system response, making pain signals much stronger than they should be. Diagnosis is based on clinical criteria, and early recognition is essential for effective management. Treatment involves a combination of physical therapy, medications, nerve blocks, and psychological support. With the right approach, many people with CRPS can regain function and improve their quality of life. Thank you for watching. As always, take care of yourself and make the most of your day.